If you're struggling with hand arthritis, here are 6 tools worth knowing. They may help ease your pain, and they're all backed by research. I'll also give you an honest verdict on each one, so by the end of this video, you'll know exactly which ones are worth it. Hi, I'm Dr. Alvarez, a rheumatologist, and welcome to RheumCare. Every week, my patients ask me the same question: what should I actually buy? And I completely understand why people ask, because when you're dealing with hand arthritis, you're not just dealing with pain, you're dealing with small frustrations that add up every single day, things that used to be simple that suddenly aren't, and you want relief, real relief. So you go online and there is no shortage of answers. Compression gloves, splints, paraffin wax, gadgets that promise to change your life in a headline, and they all sound convincing. But here's the problem. Not everything that's popular has actually been tested in a clinical trial. And some things that have been tested, the results didn't hold up the way the marketing would have you believe. So I went back to the actual research, the clinical trials, the guidelines from the American College of Rheumatology and the Arthritis Foundation, and I want to walk through it with you. Not a shopping list, an evidence check. If this is the kind of content that helps you, make sure you hit that subscribe button so you don't miss our future videos. Let's get into it. Let's start with something that isn't actually a tool, and yet it's the most important thing on this entire list: exercise. Specifically, structured hand exercises. Now, I mentioned 6 tools today, and Therapy Putty technically counts as one, but the real intervention here isn't the putty itself, it's the exercise program behind it. The putty just makes it easier to do at home. A systematic review of hand exercise therapy in rheumatoid arthritis found real improvements in grip strength, power grip, pinch grip, without making pain or disease activity worse. And putty-based strengthening programs, tested in patients with chronic rheumatoid arthritis, improved hand function and quality of life over 12 weeks. In the UK, this idea became a full program called Ther, Strengthening and Stretching for Rheumatoid Arthritis of the Hand. It's recommended in national guidelines, and there's now a self-guided online version. If you take away one thing from this video, let it be this one. It's the cheapest thing on this list, and it has the strongest evidence behind it. Next, paraffin wax baths. You dip your hands in warm, melted wax. Let it set, then peel it off. It sounds almost too simple, but a meta-analysis of randomized trials found it measurably reduced pain and improved grip and pinch strength, especially over a several-week course, and especially paired with exercise. The evidence isn't huge, we're talking about a handful of small trials, but it's consistently positive, and the risk is low. Countertop units are inexpensive and easy to use at home. This is a solid, low-cost addition, not a replacement for exercise, but a good partner to it. Now here's where I want to be honest with you, because this one surprised even me. Splints for the base of the thumb, the joint most affected by hand osteoarthritis, are recommended in the guidelines. Earlier trials and reviews show they help with pain and function. But the most rigorous trial we have, a large 349-person randomized study called Otter-2, found that adding a thumb splint on top of a good self-management and exercise program didn't add extra benefit. Every group improved. The splint group didn't do better than the exercise-only group. So what does that mean for you? A splint can still help you get through a flare, or a task that really aggravates your thumb. Just don't expect it to replace the exercises we already talked about. Think of it as backup, not the main plan. Compression gloves are everywhere, and I understand the appeal. They're comfortable, they're marketed everywhere, and plenty of people swear by them. But the largest trial we have, called A-Gloves, tested real compression gloves against the placebo glove in over 100 people with rheumatoid arthritis. After 12 weeks, Both groups improved about the same amount. The researchers' own conclusion was that routine use could reasonably be stopped. Here's the interesting part though. People in both groups still said the gloves helped them feel better and pointed to the warmth, not the compression, as the reason. So if you already love your gloves, keep wearing them. They're low risk, and warmth genuinely does help sore joints. Just know you're paying for comfort, not for a proven mechanism. Last one on the evidence side. TENS units. Those small devices that send a mild electrical pulse through your skin. The way they work is based on something called the pain gate theory. The electrical signal essentially competes with the pain signal on its way to the brain, and for some people, that interruption brings real relief. The research here is genuinely mixed. A Cochrane review of TENS for rheumatoid arthritis of the hand found some short-term benefit for pain, but newer, broader reviews of TENS for nerve-related pain haven't found a clinically meaningful effect. My honest take, it's low risk and some patients do find relief, especially when they use it around activity, not instead of it. Just don't expect it to be a standalone fix. Now, not everything that helps has been through a randomized trial, and that's okay. The guidelines themselves recommend something simpler. Look at what's actually hard for you and get a tool that removes that specific barrier. That's called joint protection, and it's genuinely evidence-based advice, even when the individual gadget isn't. A few categories worth knowing. For jars and lids, an electric jar opener for the toughest days, or a simple rubber grip opener like OXO Good Grips for everyday use. In the kitchen, swivel peelers, rocking garlic presses, and built-up handle utensils that don't ask your fingers to curl tightly. For writing, an ergonomic pen, like a Pilot Doctor grip, or just a foam grip added to a pen you already own. For getting dressed, a button hook with a zipper pull, which consistently ranks as the single most useful dressing aid for arthritic hands. And for your house, key turners and silicone doorknob covers that turn a pinch grip task into a whole hand task. One practical tip, look for the Arthritis Foundation's Ease of Use seal. It means the product was actually tested by people with arthritis and reviewed with hand therapy input, not just popular on a shopping site. So if I had to boil this whole video down to one sentence, exercise first, comfort tools second. Hand exercises and therapy putty have the strongest evidence. Paraffin wax is a great low-risk add-on. Splints, compression gloves, and TENS can genuinely make you feel better. Just go in knowing the evidence for each is more modest than the marketing suggests. And for the everyday stuff, jars, buttons, keys, the right tool really can give you back a little independence, one task at a time. None of this replaces a conversation with your rheumatologist or a hand therapist, especially if your hands are changing quickly or the pain is new. If this was helpful, subscribe for more episodes like this one. We go through the evidence so you don't have to. And as always, this video is general education, not a substitute for individualized medical advice. Every source I mentioned today is listed at the end of this video and in the description below. Take care of your joints, and I will see you in the next video.